Thank you very much everyone for being here today for a discussion on, or an open discussion in a sense, on open dialogue as part of the Parliamentary Friends of Mental Health. Open dialogue, or otherwise known as the Finnish model, is something we've been hearing a lot about recently, and it was one of the things that I was intrigued to hear more about and how it's operating and how we might be able to apply it here in New South Wales as well. So if I hand over to Niels and welcome you to New South Wales Parliament and the Parliamentary Friends of Mental Health.
Dear audience, my name is Buus and I'm the Professor of Mental Health at Sydney University, and I'm the Director of the Centre for Family-Based Mental Health Care at St Vincent's Hospital, Sydney. I'm part of a network of academics, social and healthcare practitioners, consumers, peer workers and carers working with implementing open dialogue at healthcare sites across New South Wales. Open dialogue is about creating integrated and transparent healthcare provision for patients, families and their helpers, and it's about assisting patients and families in creating new psychosocial resources in their social networks. So when we got this kind invitation to talk today, I was in no doubt that I had to draw on my peers in my social network. So today I'm joined by 4 members of the advisory board at the Centre for Family-Based Mental Health Care, and they'll join me in presenting some of the current challenges to the New South Wales mental health care services and how open dialogue might address some of these challenges in innovative ways. Australian mental health services have changed considerably over the last 10 years, and the Australian mental health workforce needs to adapt to these changes, in particular with a stronger focus on early intervention, families and community. National standards and mental health care policies have increasingly emphasized recovery-oriented practices and the development of a peer workforce. Despite these changes, the education and training of Australian mental health workforce continues to primarily focus on the emergency departments and inpatient treatment. A substantive refocusing of teaching curricula and clinical skill sets is long overdue. Significant changes of the healthcare services create fertile ground for innovation, and the recovery movement has grown rapidly and vocally as part of a growing interest in self-help as a reaction to the perceived weaknesses of mental health care policies and services. The recovery movement asserts the rights of people with disabilities to live full lives, to have access to employment, education and full citizenship. In short, they have the right to the support they need in order to recover their lives, even if their mental health problems cannot be eradicated. In the present context, recovery refers to the possibility of achieving a meaningful and more resilient life, irrespective of mental health symptoms or disabilities. Open dialogue is a Finnish approach to mental health crisis intervention and ongoing care to people experiencing a crisis. It's a person-centered approach which aims at mobilizing an individual's psychosocial resources by engaging them, the family, and the individual's social network in a series of meetings. The approach makes intuitive sense, firstly because it focuses on early intervention by responsive healthcare systems, which is in contrast to a lot of the current practices where intervention begins when a person presents acutely ill in an emergency room. Secondly, because it focuses on the power of social networks. This is in contrast to a lot of the current focus on treating only the deceased individual. And thirdly, because it aims at integrating public and private healthcare services, which is in contrast to the present services that often functions in a fragmented and highly siloed way. Hospitalization is often traumatic for patients, costly for the healthcare systems, but preventable. From a humanistic point of view, we must be better at acknowledging the recovery movement's focus on people living full lives. It's the right thing to do. From a financial point of view, we must shift our focus from treating acute illness towards early intervention, it's simply too expensive to intervene when damage is done. An open dialogue engages these issues in innovative ways. There are two essential parts of open dialogue. Firstly, it's about using network meetings to create integrated healthcare delivery, and secondly, to create open dialogues during the network meetings as a particular dialogical approach to psychotherapy. Open dialogue treatment is organized around a series of network meetings where the significant parts of a patient's social network, both private and professional, comes together to discuss concerns and to take decisions about the treatment. All significant decisions are discussed at some length and taken during these meetings. This is done to ensure a high level of transparency for the family, for the patient, and for all the members of the team of professional and lay helpers. Evaluations of the effects of open dialogue in Finland are encouraging, demonstrating improved clinical and functional outcomes after 5 years. And on the basis of a register-based cohort study, Cycler and colleagues found lower psychiatric healthcare utilization. The group receiving open dialogue were hospitalized for less, an average of 36 days, than the comparison group receiving treatment as usual, having an average of 117 days. Furthermore, they found improved employment status, where 83% of the intervention group were studying, working, or job seeking, against only 30% in the comparison group. Now I'd like to hand over to the second speaker, Kathy, who will introduce herself.
Good afternoon, and thank you for this opportunity to support the Open Dialogue initiative being implemented by Niels, Buus and his team. But it is especially pleasing to see consumer and carers included in this team. My name is Kathy McCabe. Today I am here to share my family's story so that you can hear about the real pain and suffering that is endured over the years of navigating the health system, both mental and physical, public and private, and get a real sense for the need for an alternative approach. I am a mother of 3 young adults. 2 of my daughters live with chronic illness, which led to one of them developing a psychosis at the age of 16 years old. She is now 25 years old. There was something not quite right from day one. She was always sick, double the length of time any child was sick. She was sick for 2 weeks with a cold, a month with chickenpox, always fatigued, never sleeping, constant infections, the list goes on. So until she was 16, I navigated the physical health system. At that time, no one ever took her symptoms seriously, or her needs were never addressed because she looked healthy, was well groomed and cared for. It was not until the psychosis that we were thrown into the mental health system. As the psychosis developed, she became suicidal. She spent a good 6 months in this acute state while we looked after her at home, only to drag her to countless appointments in the city, sometimes having to literally carry her to the car. A good 3 months was spent with 24-hour constant supervision to prevent her from taking her life. The only rest we got was if she slept. It was exhausting, mentally and physically, and took a huge toll on the family, and we eventually had to admit her at 16 years of age into an adult mental health hospital, as we could do no more to keep her safe. This was probably the worst day of my life. I have never been so confronted in my life to put my beautiful daughter at 16 into a place like that. At the time, there was nowhere else to go. I couldn't keep her safe any longer. Looking back, if open dialogue had been an option, I may have been able to invite others into network meetings and arrange extra care and respite for our family at home, rather than the added trauma of a hospitalisation. Unfortunately, we have experienced stigma and isolation as a family during this, but with education and support, our extended family, friends and community, could have been included in her care, and relationships could have been preserved rather than strained, and in a number of cases dissolved. Our lives are not what they should be. They are constant doctor's appointments, hospital parking fees, monitoring, managing and organising medication regimes, medication side effects, along with constant worry and stress. My health and well-being as a carer has also been significantly affected. I have started my own peer support group, as it was the only way as a mum I was going to get some real support. We are, fortunately or unfortunately, I'm not quite sure, a very small select group of mums. We are all isolated in our communities, sad, lonely and withdrawn given our circumstances. Defending and explaining an invisible illness to our community is exhausting. Our family and social lives have become smaller, and only those who truly understand our situations and give us support are welcome into our world now. Open dialogue could have prevented this from happening and actually helped to strengthen the community we lived in. Open dialogue could have given us a level of support that we missed out on. We have waded through the journey and the system as a family, hitting brick walls at times, but on the one hand, we have been very fortunate to have access to very passionate and dedicated clinicians who worked with an early intervention model of care. I have spent the last 9 years banging on doors, as I say, to try and get various doctors from different organisations to talk to one another. I will continue to bang on doors to get what she needs to improve her life. I now manage her healthcare over 4 different organisations. To improve the overall well-being of all, her healthcare needs to be more seamless, collaborative and coordinated. Open dialogue could assist in making this collaboration possible. I thank you for your time, and I look forward to helping to continue to improve the mental health system of New South Wales and see a system that delivers a sustainable benefit to those affected, their families and their communities. I see open dialogue as a real alternative that can deliver better outcomes. Thank you.